A really interesting one, menopausal osteopenia. They got 1.2 grams of potassium as citrate, little calcium, some vitamin D, actually really little. And you see improvement of bone density and bone structure, quality of bones improved, just as effective as a reputed osteoporosis drug. And now comes the interesting thing. They had a control group. And the control group got potassium, same amount, but potassium chloride, the acidic or neutral potassium. And there it got worse. So a huge difference between potassium chloride and potassium citrate. Like all the people with cardiac arrhythmia, they usually get potassium chloride and not potassium citrate. There's a lot of basic misunderstandings also in the medication then if you don't understand these basic mechanisms. All right, now we come to an actually really thrilling topic. And a spelling mistake, that's calcification, not calcification. Thank you. So we are now 60, kidney is a little, well, still okay, but a little damaged. No, creatinine is a little increased. Our bicarbonate buffer is getting a little low. And we are strong men. Well, I'm a manager on a low-carb diet, and I really compete. And I go for my jog. What happens? Where is the real problem occurring? Any ideas? It's there in the graph already, but so naturally and healthily your pH in your blood goes down. But it will go more down because your buffer is not so great. You can deal with it. The problem is there are certain parts of your body which do not get as much oxygen as they would need for the intensity of sports you're doing or intensity of stress you're having, which is like your heart muscle. Yeah, your arteries, coronary arteries are already have shrank already 50%, and now you're putting really burden on it. And then you don't have an aerobic energy production anymore. You switch to lactate or to glucolysis, and you have a dramatic drop of pH. Locally there at the heart muscle, where nobody measures, not even intensive care unit, they measure in there. So what happens then? You have a real dramatic drop of pH just from sport. That's angina pectoris in the extreme case, but it doesn't have to be so much. So then locally your pH really drops. What happens if your pH really drops? Most of the calcium is bound to proteins in your blood. Because calcium is a very reactive signaling molecule. So 50% of it is bound to proteins. And when your pH drops, it's set free from its bondage. You have free calcium, very reactive. Two things happen. Free calcium says hello to the free phosphate and starts falling out as calcium phosphate. That's the calcification, which happens most of the time in that scenario. That's bad, but it's not deadly. But calcium is the most important signal molecule in blood clotting. That's why doctors always use citrate, in their blood samples to prevent this. So you activate your blood clotting, and that's about what a heart attack or stroke is. Your blood clotted. There was a tradition of, when they had angina pectoris, they just took sodium bicarbonate and the angina pectoris went away. Early heart attacks can be dealt with. In acute cases, sodium bicarbonate is good. In chronic things, not. Just on a side note. This is a very clear, scientifically crystal clear mechanism nobody talks about. And it gets worse. No, that's not worse, that's better. That's the again, calcium. You have free calcium now. No, before it was with protein, now it's free in the floating around with its water dress, and the phosphate floating around. And the problem again is in dropping pH, they react and they sediment. You have calcium phosphate. That's the stuff that calcifies arteries. Inflammation triggers it, but hypoxia also. And of course, a chronic acidosis. That's why you have in patients with chronic kidney disease, much more calcification and much more vascular damage that you would ever expect. And that's the reason. They are the most acidotic patients there are. And you get that in a very clear form. With most people, it's a lot milder. So, one part of the problem we are a little back now to the heart attack thing, because there's one other mechanism again. You have these erythrocytes that need to go through these tiny vessels at the end. They're smaller than themselves in the microcirculation. So you have local ischemia and acidosis we discussed. What happens is the protons enter into the erythrocyte. Then you have an accumulation of sodium and calcium and a loss of potassium and magnesium. And you have, as an osmotic effect, a direct edema of the erythrocyte, and in addition, a lowering of the membrane potential. So they don't, normally erythrocytes kick off each other due to the membrane potential also. Now you have a swollen, huge erythrocyte that can't get through here anymore. In addition, you have an activated blood clotting. You have everything you need for heart attack. Like a staling perfusion plus blood clotting. Great. That's why nowadays we have strokes at the age of 40 or heart attacks at the age of 80. 40, 50 years ago, that was completely unheard of. You really have to combine quite a few things in your lifestyle to manage that. But we do it. You just combine energy drinks, high protein diet, a lot of salt with a lot of stress, and lack of sleep, and you can get there. So, another effect, potassium softens the vessel, and salt makes them hard. So we have the erythrocytes hard, and now with a high salt diet, we also have the vessels hard. So it just doesn't get through anymore. In the naturopathy, that's called acidotic stiffness of the erythrocyte. All right, this is a little summary of all the effects we have there, before we come to talking more about the solutions. In the calcification thing, there's also other things you can do to counteract it. There's a lot of promotion of K2, to decalcify arteries. That helps. But the underlying problem is this, and unless you address it, it won't really work well. Any questions to anything on this slide? Otherwise, I move on to the solution, and we have to start with the solution, a little complicated as I am with the liver, because the liver is the organ that detoxifies most of the acids, all the organic acids. The kidneys takes care of the anorganic, the liver, the organic ones. And it takes care of our energy production, takes care of our detoxification. It's a really important hormone, and we are really nasty to it. And the kidney is really, the liver is really very dependent on what comes out of the intestines to it. So we have 10 times more intestinal bacteria than body cells, and they have an incredibly strong metabolism. And a healthy colon is slightly acidic, which is very important because then you excrete through the stool all the ammonia as ammonium. A sick or unhealthy colon is basic or alkaline due to the putrefaction metabolism of Clostridia and other bacteria. And of course, if you eat a lot of proteins, you get exactly that problem, putrefaction. Well, even the freshest meat turns into rotten meat in the average passage through our European intestinal tract, which is like 2-3 days, rotting there at 37 degrees body temperature, and you have all that stuff, cadaverines, all really terrible toxins you would never eat if you see it lying there. But you make it yourself, together with your intestinal flora. No wonder that it's connected with rheumatism and leaky gut. There's these bacteria called Clostridium perfringens because they cut through your gut, and they are very widespread in meat and sausages and so on. And that's all really proven. It's not hearsay. That's very clear connection. So intestinal dysbiosis, a big factor is too much meat, too much animal protein, too much animal fats, and too little dietary fiber on the other side. Of course, it's also too much sugar, obviously, and we don't need to take antibiotics. If you eat meat, you get them on a daily basis because all the animals are fed a lot of antibiotics. That's why we have so many resistances and so on. We have an explosion of gut disturbances, leaky gut, allergies, intolerances, and so on. As I said, ammonia is then not excreted, but absorbed through the liver, which has really a hard job to detoxify it. In an alkaline milieu, it's in gas and absorbed. In an acidic milieu, it's a salt and goes out. If you go to a horse barn, you smell ammonia because a horse shits it out with a stool. That's why it has no problem with it. It's the cat. The cat has to pee it out after it goes through the liver and so on. And what do cats do most of the day and night? Somebody has a cat? Sleep, yeah. They look like a liver patient with little leaps of activity. Very interesting. My mother was in Africa, and then I looked at a movie with lion puppies and the mother. And the lion puppies, they were so energetic and happy, and the mother was like really cranky. So what the lion baby, it lives from fat, especially in the mother milk. No, it still has energy, and the lion mother and the lion family hanging around most of the day. That happens if you take in too much protein and need to detoxify it in the liver. The problem is really your energy metabolism gets a metabolic blockade. You can also call it ammonia hangover or the Garfield syndrome, as I named it. It also affects your ability to disacidify. So on the one hand, you eat a lot more acids. On the other hand, you cannot process them properly, so you have a double problem. Yeah, we had that. So why now the lactic acid? They are good acids, obviously, and the lactic acid is a very important one. That's why lactobacilli are so good. It's because they make lactic acid, which lowers the pH, which helps to excrete ammonia. Also, lactic acid is metabolized into butyrate, which is anti-inflammatory, anticancerogenic, short-chain fatty acid. So, you do something good to your mucosa, you give your liver a break, so that it can detoxify and deacidify and produce energy. It's great. That's why a horse is so much more energetic than a lion.